Hello,
Hi, good
hello.
morning. How are
There
you?
she is. I'm great. How are you, Debbie?
I'm excellent.
Awesome, awesome.
Good to
All
see you.
right. Yes, you too. So thank you for coming on this morning. I know the new technologies and things like this are always fun to have these experiences with. So I appreciate it, but I think your story is a beautiful one and extremely worth sharing. So I
Thank
appreciate
you.
you coming on here. So as a few other people are joining in, I started already talking about a little bit about your healing journey and how you were in the medical field, and so let's get the show started because we only have an hour before we get cut off, and
Got it.
I wanna get your story out there, and I want to hear let people hear about your healing process. So thank you all for coming. This is the episode number 15 of the Art of Mindful Medicine, an introduction to our health and wellness practitioners and influencers. I am Dr. Seth Gilson, biological dentist, certified yoga teacher, speaker, and personal coach. And I have a very special guest today who is a personal family friend and a beautiful woman from inside and out. And today I'd like to introduce you to Debbie DeJesse. And she has a beautiful story of becoming a registered nurse. She has a bachelor's degree in nursing from Florida International University and a master's degree in nursing education from Walden University. As a single mom who cared for a variety of patients, from treating pediatrics to her passion in emergency medicine and joining a federal disaster response team for 22 years. Debbie was an instructor on emergency management and the significance of stress management and nutrition on chronic disease to healthcare providers. She's become her own teacher and healer. Now she's focused on teaching this to others. So, Debbie, say hello. Thank you again for coming, and we will get started.
Hi, and good afternoon, everyone.
Yes. Okay, so as always, I always like to start with gratitude. So, if you could please tell us three things that you are grateful for today.
Wow, only three.
Yeah.
Um, okay, first off, I'd have to say family.
Mhm.
My journey started with a very small one, and I've created a much larger one. So I'm very grateful for that.
Mhm.
In the current chapter of my life, I've had six grandbabies born in 5 years, with two more due next month.
Awesome.
So that is an awesome story in and of itself.
Yes.
Second thing, my health journey. I'm very grateful for the fact that I am feeling much better than I was a couple of years ago. And I have been empowered with the opportunity to meet practitioners and providers who have made all the difference in the world. And then the third one would be the opportunity to inspire that to
Mhm.
others, and to share that with people that might feel hopeless or helpless,
Mhm.
who don't understand their journey and the options available to them.
Mhm.
So,
And
so
that
those are
the third one's really profound actually because we don't always think about other people's perspectives on problems they may be having, and because you've had a medical background and things like that, you've been able to look at your situation and analyze it from a cerebral medical standpoint, and then say, okay, I tried these things, this didn't work. What else is out there? Because a lot of people don't have the knowledge base or capability to do things like that. So that's why
right.
I think that it's a very powerful message that you have. So
Right. No, I was very, very grateful when I was going through the recent struggles that I did understand the medical thing and became my own case manager, sort of,
hmm
because, again, medicine has changed dramatically in the last 20 years,
hmm
from an administrative standpoint as well as from a practice standpoint.
yeah,
So
absolutely.
having a knowledge and not unrealistic expectations is really helpful.
Yes, the realistic expectations part is very
Yeah,
important.
huge.
Yeah. All right, so tell us a little bit about you, where you grew up, how you grew up. I mean, touch on some of the real important things there, the emotional aspect, behaviorally.
Of
What was
course.
the environment, health wise? How did you develop all this knowledge from a young age?
So I was raised in Los Angeles,
hmm
and I was kind of alone in an adult world, if you will. I was raised by a single mom. I lived with my mom, my grandmother, and eventually my half sister, who's 10 years younger than I am, for a period of time. So I was not really integrated into like the kids' birthday parties and the happy meals and those kind of things. So in a way, that's positive.
hmm
I learned to eat what the adults had at the table instead of always wanting the junk food we often see kids preferring these days. But it also created a situation where I was very independent and entertaining myself.
Mm-hmm.
So my hobbies reflect that, and my path reflect that. On a negative note, I found that my mother always seemed to be relatively unhappy and unhealthy. It was not uncommon in my house that you could set your clock at 5 o'clock every day by cocktail hour. And, you know, it was very common. Everybody had a couple of cocktails every day. Everybody in my house smoked. And so health was not top of the priority in learning, if you
Mm-hmm.
will. Um, but again, as a child, you don't really realize that until you go back and reflect upon where
Mm-hmm.
did I come up with these ideas. Um, I did reflect on the fact growing up that there wasn't a big support system. I had no aunts, no uncles, no cousins, no siblings when I was younger. So learning from other people was a new experience for me as I grew older as well.
Mm-hmm.
Um, I went to school and was relatively under the radar. I had good grades. It wasn't difficult for me. Um, so that's a good thing and a bad thing, because then there was no mentors. Living in a house with all women,
Mm-hmm.
nobody really encouraged me to have a insight for a professional future, to go to college, to get scholarships or what have you,
Mm-hmm.
even though you have a good GPA. Um, I graduated at 17. I had a late birthday in November, so I started school at 4.5. And getting out of high school at 17 and saying, okay, you're on your own, go do something,
Yeah.
without college being part of the dialogue.
Yeah.
I moved, I lived with friends, I had a basic job at a finance company. And then I met somebody who I married and moved with to Argentina for 3 years. And I
Mm-hmm.
think this was a huge transition for me. It was like moving to the moon.
Yeah.
Everything was different.
Yeah.
I mean, I didn't speak Spanish. I
Mm-hmm.
didn't know the metric system. I moved to a country that was under military government at the time.
Wow.
So it was really an eye opening
Yeah.
experience. But on the other end, I've always been a positive person, and I looked at what the benefits were. And all of a sudden, I was in a Latin environment where family was number one, and there
Mm-hmm.
was huge, extended, multicultural,
Yeah.
multi generational families. And this is something that was totally foreign to me.
Mm-hmm.
And I really embraced that. It was a wonderful opportunity to see a different way of life.
Mm-hmm.
And for anybody that hasn't lived in another country or worked in another country, from the perspective of not just being a tourist and seeing the different priorities and the way that they handle health and the way that there's a support, it's absolutely um, mind boggling. It was life changing.
Mm-hmm.
I saw that come from LA where everything was materialistic. All of a sudden, that wasn't so important anymore. Everything didn't have an expiration date. You didn't have to run out and buy the next new thing or the next, you know, labeled
Mm-hmm.
item.
Mm-hmm.
So all of the focus was different. You embrace the older generation for their knowledge and their wisdom,
Mm-hmm.
which we learn as we get older comes with time.
Mm-hmm.
And they didn't push everybody in the family off to other providers. You know, it wasn't the daycare and the nursing home. So I think there's a lot of education in that,
Mm-hmm.
a lot of the holistic family remedies,
Mm-hmm.
learning, having people help me learn to speak Spanish, and just overcoming challenges and obstacles really empowered me.
Yeah.
My first son was born down there, so I became a patient in a country where I didn't speak the language
Mm-hmm.
before I became a provider. And that was definitely a huge lesson that transitioned to my practice in later years.
Mm-hmm.
Moving back to the United States and becoming a single parent soon after that inspired me to look for a practical job that I could utilize the things that I'd learned, and I could empower myself to have control over raising my children and my life. And that led me to nursing.
So
Um,
before we get into the in-depth nursing part,
yeah,
I definitely want to talk about that. Um, living in another country, I mean, other than the deep family roots and ties and things, because I
mhm,
mean, like you said, you grew up with it was still a multi-generational household what you had, even though it might not have been centered around the loving family like it is in a lot of Latin cultures.
right.
But what are some other takeaways that you had from those experiences from living in another country, like you said, under military law? And I mean, that's just, I mean, for most people, especially in the United States, that's like, I mean, it literally is unheard of. So,
Right, right. Well, I was young and naive, so there are blessings in that because I didn't go into it fearfully.
Hmm.
We won't get into political
Yeah.
conversations today because there's too much. That's a path we don't want to take
Yeah.
today. Um, but learning to trust, learning to embrace the multicultural, I mean, the multi-generational household I grew up in wasn't really a caring environment where people were encouraging one another. It was more of a functional situation, if you
Hmm.
will. So, in the situation I found in Argentina, they taught me to cook. They taught me family history. They taught me culture.
Hmm.
And this is something that I hadn't really embraced or been exposed to as a young child.
Hmm.
So it was fascinating to me. Learning the metrics, walking every day, leaving my house with my dictionary in my hand, and walking to the vegetable store and the meat market. And there was no grocery stores.
Yeah. Yeah.
There was not a single grocery store
And
there
no
when I
iPhone
lived
for
there
you
in
to
the early
translate.
80s. Um, I learned to speak pretty good Spanish, which also came in helpful later on in my life, and
Hmm.
I still do.
Well, that's what I was
I
saying. But there was no phone to help you translate. You're walking around with like a little English Spanish
Right.
dictionary.
There was no internet. I
Yeah.
live not in the middle of Buenos Aires, but in a small suburb outside near the airport.
Hmm.
So I couldn't answer my phone. I couldn't turn on the TV. I couldn't listen to radio. Everything was Spanish.
Hmm. Yeah.
So I learned how to speak Spanish by watching subtitled sitcoms, Kung Fu, The A Team. Seriously,
No,
it's
that's great.
hysterical.
That's
I
awesome.
would go to the movie theater and watch American movies that were translated, but things don't translate exactly,
Yeah.
especially humor.
Yeah.
So I would laugh at things and everybody would look at me like, what's so funny? Because I was listening to the original language.
Yeah. Yeah.
And I got brave and I would go to movies that were subtitled in Spanish, spoken in some other language, so I would learn
Oh
how to
wow.
read.
Wow. No,
Um,
that's a good idea. Actually, I haven't
I
thought about that one.
yeah,
Uh.
it forced me into it.
Hmm.
And I would go to the store, and the first thing I learned to say was, "Como se dice?" How do you
Yeah.
say
Yeah.
this?
Yeah.
Or what is that? Or how do you cook this?
Yeah. Yeah.
And they embraced me and they would help me. And it was such a collaborative effort. And it was a, learning what a community is like,
Beautiful.
being embraced by a whole community. And the growth that and the help that came from that was just really wonderful.
Awesome. That's a beautiful experience. So I want to shift gears a little bit and tell
Sure.
me a little bit about the conditions that you have so people can have a little bit of background on that aspect of your life and then we'll retract again to a different part so you can start telling more of your story. But I want people to know what exactly been going on with you health wise.
Okay, so the condition I have, I was diagnosed with a rare disease called Klippel syndrome.
Hmm.
And this official diagnosis didn't come till I was in my 50s. It came as a result of me researching things
Hmm.
and listening to things and looking things up and asking a ton of questions and then going to other practitioners. Klippel syndrome is a genetic condition that occurs during development of the fetus.
Hmm.
So sometimes it's an obvious thing when you're born, and sometimes it's a hidden thing that symptoms later in life show themselves.
Hmm.
I had obvious symptoms, but nobody really asked questions. I fortunately was born near a very large teaching hospital, thank goodness. And in that teaching hospital, I had surgery twice before I was 6 months old.
Wow.
And one of them didn't have a scar, and the other one I had a thoracotomy scar, which goes all the way around my chest. And I remember asking my mom, "What is this?" And she said, "Oh, they found something in your chest and they removed it, but it's no big deal." And that was the extent of the knowledge she gave me from that. And I think way back then, people didn't really question medicine that much. So the
Hmm.
doctor says this, you just say, "Okay, fine," and you move on.
Hmm.
If they don't say it needs to be followed up, then you don't worry about it.
Hmm.
In my discovery, which wasn't easy because it's a 1 in 40,000 people have it, so there's not a whole lot of information out there unless you really dig. Um, it can present in many different ways. It's typically the fusion of two or more cervical vertebrae,
Hmm.
and then it can progress from there. So some people have cardiac involvement, some people have respiratory involvement. Cleft palate is not uncommon. Anything that develops at the same time, so all of the bones in
Yeah,
your head, your face,
that makes
and you
sense.
being in dental, we've had some conversations.
Hmm.
So your hearing can be involved. Some people are born deaf.
Mm-hmm.
I found out I had congenital hearing loss when I was in my 50s
Wow.
because I kept asking questions saying this doesn't seem right. Luckily it wasn't profound,
Mm-hmm.
but unluckily it wasn't identified, didn't know any different.
Yeah.
Um, the spine, if in researching it, finding things like scoliosis, vertebrae that aren't closed all the way, spina bifida occulta, extra parts that are missing, parts that are in weird places.
Mm-hmm.
So it can present very, very distinctly with each individual patient.
Mm-hmm.
Um, so the research of it alone was a huge journey.
Yeah.
I was born with an extra lumbar vertebrae, the scoliosis, the spina bifida occulta, the Springles anomaly, which is the shoulders
Mm-hmm.
being positioned differently,
Okay.
uh, extra lung, reproductive organ issues. And again, none of these things were really diagnosed early on. It was just me researching it and going, oh, this is connected to that, and
Mm-hmm.
that is connected to that.
Mm-hmm.
Um, but most of the doctors that I would treat with or that I would go see had never heard of it,
Yeah.
except for the spinal surgeons and the neurosurgeons who'd heard of it but weren't intimately
Of
familiar
course,
with,
because
you know,
it's so rare.
geneticists, yes, especially when there were profound anomalies and changes that the parents would be sent to a geneticist who would do diagnostics and training, typically at large hospitals. I only found two in the United States that specialized in this um, syndrome. So, again, the information really wasn't out there. I had to dig for it, and my knowledge of medicine gave me the ability to know which road to travel and how to ask questions.
Mm-hmm.
So, I was grateful for that. Um,
Absolutely.
I had one surgery as the result of an accident
Mm-hmm.
back in 2001, and that kind of was what opened Pandora's box, if you will.
Mm-hmm.
I had a cabinet fall on me from a new construction house, which sent me to the hospital. And as a result of that accident, it pushed my C4 vertebrae into my spinal cord, causing cord compression. So I'm grateful I'm not in a wheelchair and I'm not on a ventilator.
Mm-hmm.
And I look at the positive, outcomes based on what it could have been.
Yeah.
At that point, of course, they railroaded me into you have to have surgery. And I didn't know any better at that time. I worked in regular Western medicine, so I didn't question any alternative therapies.
Mm-hmm.
And when you're dealing with your spine, it's kind of scary.
Yeah.
So I did go down to Jackson and was treated very well and had my first surgery, which fused me at 4 levels in my cervical spine and prevented me from doing the same kind of nursing I was doing at that time. Um, but it did allow me the opportunity to recover sufficiently to be able to go back into a different area of nursing, which I'm grateful for. Um,
And for example, this injury, and you said a lot of these diagnoses didn't happen until you were in your 50s.
right.
Um, but in what time relation, like when you came back to the United States from Argentina and raising children as a single mom and readapting to the food and the culture, what was that like? And then in relation to the time frame of when all this happened.
Okay, so when I came back from Argentina, I was in my late 20s.
Mm-hmm.
I decided to go to nursing school when I was 29
Mm-hmm.
and graduated right after I was 32, I believe, um, and started practicing in regular medicine. My congenital anomalies and my physical challenges didn't really present themselves until in a meaningful way or anything that I would actually look into. I'd had the surgery as an infant, but didn't need any ongoing care because luckily it didn't impact me systemically.
Mm-hmm.
Like my heart and my lungs and everything were intact and working and functioning fine.
Mm-hmm.
So it didn't really present itself again until I had been practicing nursing for several years and had that accident, which was the catalyst for me to have to go into treatment. And even at that point, it was an accident, it wasn't illness related.
Yeah.
So it was the perspective. Oh, and it was the surgeon's notes from that first surgery that opened my eyes. He said that I had a clipophile type anomaly.
Mm-hmm.
And even at that point, I was like, okay, whatever that is. He fixed me. I'm fine. I'm going back to work. As I started having degenerative changes later on, is when I really started researching what exactly
That's what I
does
was going
that
to say,
mean.
because
Right.
I believe that this, when you had the surgery and from that accident, is what kind of um, kickstarted that whole process for you,
So,
of self discovery and being like, oh, let's, so wait, you mean there's something going on here, and then you start connecting all the other dots.
so that was in 2002 that I had the first surgery.
Mm-hmm.
Um, and of course, pain management is a big thing. You had surgery, you're going to hurt. Here, do this.
Yeah.
Here, go to that. Because of the fact that I was in a lawsuit with the builder of the house whose cabinet fell on me,
Mm-hmm.
um, I was guided through a process of you need to go to this specialist, you need to go to that doctor, you need to document XYZ.
Yeah.
And I never recommend anybody, uh, let's see, be discerning about who is giving you guidance and information.
Mm-hmm.
One of my lessons learned in life was my father, who I reestablished a relationship with when I was in my early
Oh
20s.
wow.
He wasn't around when I was growing up, but we have a wonderful relationship now. And I
Beautiful.
credit him with giving me a lot of insight. One of the things he spoke to me about in finance, which is his background, is the first thing you do is you look at what the objective of the person you're speaking to is. How do they earn a living? Why are they telling you what they're telling you?
Yeah.
And I think that's relevant in everything in life.
Mm-hmm.
If you go to a surgeon and expect them to not have you recommend surgery as a solution if it's warranted, um, again, if you're going to a surgeon, that's what they know.
Yeah.
That's the modality that they work in.
Mm-hmm.
If you go to a chiropractor, you have to understand their scope of practice and you have to understand what their priorities are going to be
Yeah.
and the lens from which they're going to share
Exactly.
their
That's the
information.
exact analogy I was going to use, from the lens from which they look at the world and you,
Exactly.
because of course that's going to
Absolutely.
have some kind of influence. And being medical professionals, I mean, we've seen that. I can speak for myself. I've seen that in myself in the past, and I've seen that in others quite a bit of the time. So I mean that's a very very important lesson. I think that's a very wise thing for your
Right.
father to teach you. That's
And one simple lesson related to finance can also be applied to every other area because
mm-hmm.
again, it's how you perceive things, how you interpret things. There's three sides to every story:
Mm-hmm.
one person's side, the other person's side, and the reality, which lies somewhere in the middle.
Yeah.
We know that two people can live through the same event and describe it very much differently
Mm-hmm.
because of our perspective and our background and our history and our education.
Yeah.
So so
Absolutely.
I was all in with I just want to get fixed and go back.
Mm-hmm.
I saw it as I'm broken, but they fixed me with surgery. And so I just recover and go back to work.
Mm-hmm.
And I remember them saying, the surgeon, of course, you're all fixed. Everything's better. You're as good as new. You can go back and do anything you want, except you can't lift more than 10 pounds.
Okay.
Well, I worked in a trauma center, and I don't know of any patients besides neonates that are going to be under 10 pounds.
Uh huh.
Um, and it was very cut and dry. The hospital basically said, well, you can't really practice as a nurse now because what if this happens? And so, again,
So they made it like a
discerning,
liability on their end.
right. Well, you couldn't lift a patient onto a stretcher. I said, well, I weigh 115 pounds on a good day with no injury. I couldn't lift
Yeah.
somebody larger than me safely onto a stretcher.
Yeah.
So again, looking at the information you're given and how you interpret it and apply it
Mm-hmm.
is huge.
Yeah.
The same went to how they wanted me to recover. Go to a little bit of physical therapy. That's when I learned that not all practitioners are the same.
Yeah.
So I went to one physical therapist. Okay, go over there and do these exercises. All right, whether or not I was doing them accurately, no hands on. And oh, well, that didn't work. Okay, well, we'll send you back to the doctor. So it took me 4 different physical therapy practitioners before I found somebody who was hands on.
Mm-hmm.
And at that point, when I had fallen from the cabinet, I had landed on my tailbone and partially dislocated my left hip.
Wow.
And they told me, luckily I was young, so it didn't fracture.
Yeah.
Um, and that was before I bounced backwards and did the neck injury thing in the same accident.
Jeez.
So when I went to this practitioner, they kept saying I would have pain in my hip and my low back. And they would say, you have discogenic pain in your lumbar spine because they looked at the x-rays and saw I had anomalies. And I said, but it feels to me I'm living in this body, and it
Yeah.
feels to me like it's originating in my hip and then radiating, not the other way
Mm-hmm.
around. So my lesson there was finding a practitioner in any modality or any specialty area that listened to the patient
Mm-hmm.
and not just went on, here's the diagnosis, here's the treatment. Everybody is the textbook model, if you will. I'm certainly not a textbook model, and every human is a little bit different,
Mm-hmm.
even though we have similar responses to, different things that we do. So that was the first lesson: is don't assume that something doesn't work just because you tried one physical therapist or one acupuncture physician or one diet, if you will.
Yeah.
You have to find what works for you and what meets your needs and who's going to listen to what's really going on and
Absolutely.
not just pigeonhole you.
So
Um,
your journey with nursing. I know you got into nursing. Really, it was just more to as a way to. It wasn't anything like that inspired you that you wanted to be in medicine your whole life or something like that.
no,
It was
not at
something.
all.
It was to support yourself and your kids. But how did you come to the conclusion that nursing was the place for you, and where did along the lines of your life, like where did that journey take you? Because I know you were in different areas of nursing and medicine.
Right. So I decided for practical reasons, which later on I don't recommend. I see people seriously.
Yeah, yeah, yeah. I
Again,
know. I get.
lessons learned, going back and reflecting on what was I thinking at the time? Why did I decide that? I was looking for a career that I felt capable in. I loved science.
Mm-hmm.
Um, I wanted something I could move anywhere and find work. I could work part time or full time or overtime as the needs and situation deemed appropriate.
Mm-hmm.
Having children, I could utilize the Spanish I worked so hard to learn when I
Mm-hmm.
was in South America. And I could help people because I've always liked to be helpful. I've always liked to be a resource um, at whatever capacity that was. And it seemed to me that nursing was something I could spend 2 or 3 years in school and get a license and be able to support my family. And that there was so many different varieties of nursing
Mm-hmm.
available. It wasn't just the ER or just pediatrics or just oncology. There was such a diverse field of opportunities, and that intrigued me because I get bored easily. So I said, well, that's great. If I don't like this, I can do some more education and do that
Mm-hmm.
and still stay within a profession that is rewarding and gives back. So those were the thought process
Those are
I had
very good
going in.
reasons. I mean that.
Going
I know that that wasn't necessarily your thought process originally, but
right,
I mean your journey. I mean it took
it
you there for a
evolved.
reason, and in the end, it actually. I mean life ended up pushing you there, and it ended up
Right,
helping you when it came to your own healing process. So
absolutely.
I
No,
think that's
it
beautiful.
evolved.
Yeah.
The other thing is I found an opportunity to barter, if you will,
Mm-hmm.
maybe another tool learned in a different cultural environment where, as a single parent myself, my kids wanted to go to Boy Scout camp. So for me to be able to afford that, I went to camp as the camp nurse. So you go off
Oh,
and do
that's
your
cool.
thing, and I can do my thing, and it's mutually beneficial.
Yeah.
And I feel empowered to be able to help the other kids. I would teach emergency preparedness, I would teach first aid. So it was a wonderful opportunity for everybody.
Awesome.
Um, and then the other areas of nursing, because I get bored easily, I was a tech in the ER and ended up in on a floor upstairs, which wasn't really where I wanted to be.
Mm-hmm.
But at that point in time, they wouldn't allow new nursing grads into the ER. So on my floor, when they would float people to different units, I'd say, please send me
Mm-hmm.
because it gave me more
Yeah.
exposure to opportunities. So I would always volunteer. Send me to critical care. Send
Mm-hmm.
me to pediatrics. Send me here and there.
Mm-hmm.
Excuse me.
So what were your most memorable or favorite um, areas of nursing that you were in?
I really enjoyed pediatrics.
Mm-hmm.
I love the diversity of the emergency room. I was drawn to it. I went back to it because every day was different.
Mm-hmm.
One day I
Yeah,
could be
that's true.
working in the minor care walk-in area. Again, diversity. I could be in the minor care area. Another day I was on the critical care side. Another day I was in trauma. Another day I was doing pediatrics or orthopedics. So it was more of a generalist in a lot of different areas. And to me, that translated again, to the pediatric side of things, doing camp nursing or what have you. I did home health as a per diem job for a while, which allowed me to follow up in the ER. The one negative is you have patients for a short, it's a negative and a positive.
Mm-hmm.
You have them for a short period of time, and then you send them to the different area of care. So you get to prioritize their needs and anticipate what their challenges are.
Mm-hmm.
It was like a puzzle. It was intriguing. It was inspiring for me to be able to help people understand what was going on with them, maybe tie them into outside resources, or encourage them. You'd see your diabetics always coming in with similar symptoms,
Mm-hmm.
and to be able to tell them, well, if you look at this a little bit more proactively instead of reactively, you can maybe prevent coming back to the emergency department.
Mm-hmm.
Not everybody's compliant, but
That we know, unfortunately.
not everybody's compliant, but at least if you've shared with them the information, they have the opportunity to make choices that benefit them.
Mm-hmm.
Much like what I found with the pain management. The doctor saying, we're going to put you on this, and then we're going to put you on that. And I didn't like the side effects. So instead of just saying, okay, yes, I was that pain in the rear end patient who would say, but what else is available?
Just
But
asking
why?
questions. Yeah.
But what can, yeah. And I would ask, my husband jokes these days. He says, I'm the one who asks questions that nobody has answers for, because I'm very inquisitive. I'm
And
very
those are the questions
curious.
that need to be asked. So,
And it's okay. We can go down and look for the answer, but I'm still going to ask the question because I want to know, what are the options? What are the opportunities?
mm-hmm.
Um, and so I tried to share that with patients as well, whether it's a financial resource or whether it is a group that has like or similar illnesses that can be a support group for you. Because if you're alone in something, it's much more difficult to navigate it. As I found out with my rare disease, I had to seek out the community that had answers,
Mm-hmm.
and also people who have a disease process can tell you, hey, I've had this and this worked for me, or this didn't work for me.
Mm-hmm.
So even though they're not medical professionals, they have their own personal
Yeah,
experiences,
and all that
which
knowledge helps. I mean, it culminates
absolutely.
to something that you can actually use that works for you. Because, like you said before, everybody's different, and you have to find what works for you.
Right. And I was lucky enough to be around some people. My current acupuncture physician worked in Western medicine initially and didn't find the answers he wanted. So
Mm-hmm.
I've found providers that have had interesting paths to get where they were. And again, that inspires me and gives me more questions to ask. But it also helps lead me to things I never would have guessed would have been solutions to problems.
Mm-hmm.
So asking questions has been the basis for a lot of areas I've ended up practicing in, or modalities I found that have helped me through the challenges I've been working with.
Awesome. And how did you find yourself in the disaster response team in that area of medicine? Because I think that's extremely important as well.
So I grew up in California,
Mm-hmm.
and it's no secret that California is probably one of the disaster capitals of the
Yeah.
United States.
Yeah.
They have earthquakes and floods and fires and mudslides. And so I learned early on that preparedness is important. And I guess that was some of my early personal education into being proactive rather than reactive. Um, Success favors the prepared mind, if you will. So if you have water and you know how to turn off the gas and all the things they taught us in school, like they teach fire safety here, was just a year-round thing, because your disaster can happen at any point in time.
Yeah.
You never know when an earthquake's going to
Yeah.
happen.
There's not a season for earthquakes.
Correct. And when I moved to Florida, it was right before Hurricane Andrew. I moved to Florida in 1991. It was
Perfect
1 year
timing.
before Hurricane Andrew. And I had lived through some pretty significant earthquakes when I was younger. So those tend to stick out in your mind.
Mm-hmm.
And when I moved here during Hurricane Andrew, I was actually in nursing school here when that occurred. And I said, with my knowledge base and having lived in disaster areas and survived things, I could really be helpful. And I want to be able to share my knowledge and be helpful. And so a friend of mine from the emergency department told me about a new team that was being developed here in South Florida. The inception of the team here, Florida 5 DMAT, was in 1994 after Hurricane Andrew, because anybody who was in Miami knows the resources and the response was not as coordinated as it could have been.
Yeah.
And back to that realistic expectations of, the government will come and rescue us within 24 hours, and that's just not realistic or
Yeah.
feasible.
Yeah.
But if you don't know any better, this is what you come to expect.
Mm-hmm.
So I said, well, I have a skill set. Back to I know Spanish, and I now have medical background, and I've lived through disasters, and I like to share information. So I joined that team early on, actually, right after I graduated nursing school, and transitioned to a management position within the team after that first accident, not knowing if I would be able to go back to deploying in austere conditions
Mm-hmm.
after my first surgery. But an extremely rewarding situation.
Mm-hmm.
It really framed my healthcare experience in that when you deploy to austere conditions, you are putting yourself in somebody else's nightmare. You typically live without energy, flush toilets, no air conditioning for a week or more. The deployments were 2 weeks long, but you're able to impact their lives in a way that I can't. It's hard to put in words.
Yeah.
The gratitude that is received, and the goodwill is amazing. And a lot of the things we've come to be challenged by in medicine now are kind of taken out of the equation. There's no pre-authorizations. There's no insurance that you have to deal with.
Mm-hmm.
You don't have to worry about if somebody can afford your care or not, because you show up and all of your services are free.
Yeah.
And you're working with a team in a situation where everybody covers everybody's back. So you have an opportunity to talk to other healthcare providers in other specialties, to cross train a little bit if you want to get more opportunities for expanding your career if
Mm-hmm.
that's your desire, and to have some very, very significant conversations about what the system is, what it could be, and how you can make an impact in that little period of time in somebody's life.
Mm-hmm.
It also teaches you to be proactive rather than reactive, to mitigate the problems,
Mm-hmm.
to educate. And after Katrina, the government put a lot of money into educating healthcare providers so they would have realistic expectations.
Mm-hmm.
And so they would understand how to work in an alternate environment. If you work in a shelter and your background is, say, in cardiology, but now you're with a whole group of people in an area you're not used to working in, you learn how to um, evaluate what your resources are, talk to the other providers that are with you. Even though you might be in one specialty area, everybody has personal experiences. Do you have a parent or a friend who's got kidney problems? Are you familiar with diabetics? Do you have experience with mental health challenges? And all
Mm-hmm.
of these things will come up, and you can think outside the box.
Yeah.
You can problem solve, and you can bridge that gap of knowledge in a different environment, and it's very rewarding.
Yeah, I mean, it seems like the
For everybody.
connection. Yeah, of course, the connections you make with people, professionally
Yeah.
and people that you see as patients or people that need help in some of those emergency situations. It kind of broadens your scope of awareness to what
Right.
things are and really kind of fine tunes you, like you said. I mean, because you have experience. And it's generalized experience, and some of it's more specific than others, but it's a wide variety of experiences that kind of allow you to pull from a lot of different areas
Mm-hmm.
and make decisions, which obviously very much so helped you in your journey and bringing
Absolutely.
yeah and bringing all of those things together through and also with the disorders and things that you've dealt with. What would you, and this is something we've spoken about too, that what would you say the difference between well care and sick care is, and how has that changed over the years for you?
Well, I've always tried to take lessons learned and reevaluate and look at things again. Why did I think what I did at the time? Why did I make certain decisions? How did certain things impact me? And it's important to know um, proactive versus reactive. And I look at the well care versus sick care in the same perspective.
Mm-hmm.
I like to think professionally. I used to work in sick care, and even though I'm retired from nursing, I still work in well care now because I try to inspire people and teach people.
Mm-hmm.
When I couldn't do bedside nursing, I looked at being proactive as far as teaching healthcare providers experiential things that could help in their practice, things you don't learn in a textbook,
Mm-hmm.
things that impact day-to-day practice, both for your own sanity and well-being and that of others. I learned from my first surgery to when I had the degenerative changes that led to my retirement 4 or 5 years ago. Rather than waiting for something to hurt or something to not function properly, it is really nice if you can try to prevent it from happening initially
Mm-hmm.
or head it off early
Yeah.
so the impact isn't as severe.
Mm-hmm.
And that's kind of dictated my professional and personal life for the last 10 years.
Mm-hmm.
Just having that mindset, looking for resources that support that. And it's a learning curve. It's always a learning curve. But again, if you embrace education and knowledge, um, it is seamless. Ask questions. Again, be curious. Ask other people who have gone through it what worked for you, what didn't. Ask the providers, when you prescribe this to me, here's my short term challenge, but what's the long term solution? What are we looking at as far as a solution long term? Or are you just telling me I have this thing that is permanent and degenerative that I will have forever, and you're going to put me on this medication, and the only thing I can hope for is that the dosing is going to increase and I'm going to feel worse? Well, anybody would have poor mental health if you sit there and think about only that
Yeah.
rather than trying to make an impact on the outcomes, which is why I'm so grateful that I'm actually much better than I was 4 years ago instead of much worse.
Mm-hmm.
And had I taken verbatim what was told to me, I would probably still be deteriorating. To go from a lifestyle of looking forward to your next epidural, or I was using a walker 4 years ago, and now I'm doing yoga and swimming.
Mm-hmm.
So it's just an amazing transition. Again, trying to be proactive, trying to look at the wellness and the prevention rather than waiting until something breaks or
Mm-hmm.
something doesn't function.
Yeah.
And that's part of emergency medicine as well, though. Even though we're trained to look at disease processes and manage chronic conditions, it doesn't take long to figure out that if you encourage somebody to change some lifestyle things to prevent the deterioration in the first place. I had a conversation with a friend the other day who's very well, who hardly ever goes to the doctor, but who's having a symptom as they get older. And we have to look at, even though we feel great as we get into our 40s and 50s and 60s, wellness is not a bad thing. If you
Mm-hmm.
never take your blood pressure and you don't have symptoms, you don't know if it's going out of control
Mm-hmm.
until there's something that maybe happens that's not reversible.
Yeah.
Like what happened to my brother-in-law, who was the young, fit one of the couple and dropped with a massive hemorrhagic stroke in a grocery store. And he's, wheelchair bound. And it was a surprise to everybody because he's never sick and he never goes to the doctor. But a simple screening, as you get a little bit older, that could make you mindful of situations you need to follow, would have maybe prevented that or made it a less tragic outcome.
Yeah, no, I'm definitely on the same page as you here with preventative medicine, being proactive about your health and making proper lifestyle choices that promote that longevity and that great health, because it's not about just staying alive and existing. I mean, you want to try and live your best life and have, like you said, yes, a great quality of life
Right.
while you're doing these things. And you just mentioned a couple things that I was going to switch to anyways, is yoga and mindfulness. So I want to know when you've kind of discovered yoga and mindfulness, but for a lot of people, mindfulness is mainly just meditation and yoga. And can you tell us about mindful living in your experience and how you feel, and if and how you feel accountability for one's health relates to mindfulness?
Well, and it's interesting that again, perspective based on background.
Mm-hmm.
I wasn't raised around holistic therapies. I wasn't raised around holistic minded practitioners, but I found through trial and error and being inquisitive that those actually were solutions that worked for me.
Mm-hmm.
And looking at the long term rather than just the short term. Okay, I can take this pill right now and it's immediate, but long term, what are my options and what's that going to mean for me? And how does my liver and kidneys feel about me taking this drug over and over again?
Mm-hmm.
Is it going to make that deteriorate? So being mindful again of how it impacts me today, but also what does this mean for my future?
Mm-hmm.
Um, Asking questions. How did I find yoga? Well, I have really progressive arthritis as part of this syndrome. And I know that if I don't move, I become stiffer and sore. So, what are some solutions to moving? One of my physical therapist friends said, have you tried this? Well, I found physical therapy, which led me to massage therapy, and the massage therapist would do stretching. Okay, that's a good start, but what can I do to practice on my own? And luckily, one of the practitioners recommended, well, try this kind of a physical exercise class.
Mm-hmm.
Oh, and they're incorporating yoga. And I really didn't know what that meant.
Mm-hmm.
So asking questions, finding people that would listen who would share. And I think that's what inspires me with my knowledge base and situation is being able to share with people that don't have a background, that might not know to ask questions. Just talking to somebody the other day who also had a neck injury, I believe you were there,
Mm-hmm.
and having the person say, well, I have to have surgery. And sometimes it's just somebody saying, well, have you tried this? Or have you asked that before you do something that's irreversible?
Mm-hmm.
Have you tried other things? And it doesn't always occur to somebody who's in pain or who's being challenged by a physical event
Mm-hmm.
to explore other opportunities.
Yeah.
So I think that to me is the definition of being mindful. And it's just expanded because of my wanting to get more knowledge.
Yeah.
Asking the yoga practitioner, well, what are the options? How can we modify this that it works for me?
Mm-hmm.
I laugh because when I had my last surgery, which fused my spine from the base of my skull to the middle of my shoulder blades from C1 to T2, I'm one big piece of metal.
Mm-hmm.
And it paralyzed my vocal cord, which made teaching difficult. And I didn't have a voice for the first couple of months,
Mm-hmm.
literally. I asked my husband if he paid the surgeon extra for that. Um, he denies it, but we're still on the fence with that. But again, even something as simple as my vocal cord, um, speaking regularly and going to speech therapy and learning you need to keep it hydrated and you need to this and that and the other, I've been able to reestablish the ability to speak,
Mm-hmm.
for an hour on a conversation, to be able to share. So I think it's a push and pull, it's a give and take of learning things that help you, identifying a challenge, whether it's yours or a family member's or a patient's,
Mm-hmm.
and then looking at the resources available and trying to come up with a game plan.
Yeah.
To me, that's mindfulness. And then only recently, in the last 4 or 5 years, in trying to do that for my granddaughter, who had chronic digestive issues to the point of ending up in the hospital multiple times and having them prescribe her laxatives for
Mm-hmm.
2 years. A 10-year-old on
Wow.
laxative for 2 years, I'm like, this doesn't seem right. It's one thing to fix it in the moment.
Oh.
Is she expected
Yep.
to
No,
do
there you
this
go. Yeah.
forever?
Yeah.
And what are the options?
Mm-hmm.
So that's when I started to research food as medicine.
Uh-huh.
And I transitioned my holistic practice of acupuncture and massage therapy to dietary issues, of which I hadn't really been. If you're not in a community where that's the thing that everybody's talking about, maybe you haven't transitioned to having that knowledge available to you
Mm-hmm.
or realized really how impactful it can be.
Yeah.
And making small changes a little at a time. I've been blessed with, I've never been on a diet in my life, if you call it a weight loss diet. I have a fast metabolism, but just because I'm thin doesn't mean that I'm healthy.
Mm-hmm.
And that was a learning curve. Oh, I can eat whatever I want, but does that mean it's good for me?
Yeah.
And now I have arthritis. So, yeah, I can eat a ton of sugar and I never gain weight. So, on the outside, you don't see that there's a problem. But on the inside, I sure can feel it.
Yeah.
So, unless I acknowledge it and look for solutions, I might not have ever found that there's a whole new way of living
Mm-hmm.
that provides for energy, that I don't take a pill to fix everything,
Mm-hmm.
that provides me the hope and opportunity that there's going to be long-term benefit. Sorry about that.
Okay.
Long-term benefit from making small changes, and it's hard not to think, gee, if I'd done this 20 or 30 years ago, And clearly I can't do that, but I can encourage my children and my grandchildren and my friends. Well,
Yeah.
here's what I've learned.
Yeah.
I did it that way because that's what I knew at the time.
Mm-hmm.
But I've learned that this is so much better. And think of the potential if you start it so much earlier in life, your longevity and your quality of life that
Yeah.
can be so much better.
Yeah, and that is mindfulness. I mean, being present and aware of where you're at,
Yes.
and not dwelling on where you've come from. And, oh, I could have done so much better. Maybe I would be different. Whatever. I mean, you can't.
Right.
You just took that as a learning experience, which is exactly all. In my opinion, that's all the past is a learning experience, and it's not to be
Right.
forgotten. And it's not to be
Correct.
denied. It's just something to be learned from. And you take that knowledge, apply it now, and
Mm-hmm.
give it to others. I mean, that are there and willing
Absolutely.
to receive it.
Yep.
Just like you're doing.
Yeah.
So
I
go ahead.
No, no, go ahead.
Well, so I was going to ask you because we have little less than 10 minutes about the research that you had to do, because I think that's really important for a lot of people, because like I was saying, you have some tools that most people don't have at their disposal because of your experiences and your education. But I mean, when people go to research things, I mean, especially nowadays, I mean, it's a click away. So what kind
Right.
of research did you do to learn about your ailments, and how did this change your perspective on things and on health?
Well, research is not easy. It's not quick. Like anything that is worthwhile,
Mm-hmm.
you have to put the effort in on the front end.
Yeah.
I did have the benefit of having to go through nursing school, learning through the challenging, looking things up in the library, looking things up, reading articles. It's so much easier now because with a click of a button, you can go online. But there's pros and cons to that.
Mm-hmm.
You have to be discerning, where's the information coming from? How
Yeah.
accurate is it? In teaching on prevention of medical errors, I would often say, are you looking at the $2 million advertising on the front of the label, or are you looking at the ingredients on the back,
Mm-hmm.
and being discerning and mindful of what's there and understanding it? If you don't understand it, ask somebody.
Mm-hmm.
Even if you don't have medical background, find a health coach, find a practitioner who's willing to share, read, look things up, understand research. Is the study paid for by the people who are asking? Again, what is the focus of the person paying for it?
Mm-hmm.
Do they want you to have surgery because that's how they make their money, or is that your best option? Again, continuing to be practical, I think helps tremendously. Excuse me.
Mm-hmm. So,
Um,
continue talking about the research. I mean, what kind of sources did you utilize? I mean, what are some things that you'd recommend? Like if somebody's going through uh, some kind of process where they're trying, they've either been diagnosed or they're having symptoms and they don't know what to do, and they're just not sure of the answers that they're getting, because most people, like you said before, I mean, when the doctor says something to you, they just say it, or and you
right,
just listen and you
right,
take it for what it's worth. Like, okay, this is what's going to make me better. That's what I have to do. But I mean, like you have done
right.
or exemplified and how you described it. I mean, what are some of the questions that you ask in these kind of situations?
So I started out with Google. I
Mm-hmm.
learned from being in school that there's good and bad resources on the internet. Don't believe everything that you read. Look at where it comes from. Learn how to read a research study in the simple part of how many people were involved,
Mm-hmm.
who paid for it, and what were they testing. Did they test 3 people 10 years ago? Is that a realistic comparison to what you're going through? I looked on the World Health Organization. I looked at the CDC. When I Googled Klippel syndrome, I would click on anything where it came up and I would read and see if it was relevant. And then I would ask questions. It got to the point where I had a whole folder when I would go to the doctor with previous diagnostics, and I
Mm-hmm.
would take that with me because they weren't knowledgeable on the syndrome. So I could say, here's some articles that are written in your language from journals that you utilize,
Mm-hmm.
and it would open their perspective into what I was dealing with. And so I think that was very, very helpful.
So taking responsibility and accountability, I mean, being part of the healing process and not just being
Absolutely.
subject to whatever they throw at you,
And
because
if,
you're
right,
part of that teaching and learning process. I mean, there's always a teacher and a student in a sense, but a lot of times in that relationship, the roles get reversed.
exactly,
So,
exactly. And again, asking questions. If you don't like what one doctor says, go get a second opinion. ask other professionals for insight, because um, unless you're inquisitive,
Mm-hmm.
unless you look for resources, you're not going to be able to find solutions that are meaningful.
Yes.
You can put a band-aid on it, but you have to take accountability.
Yeah.
You can't be a victim,
Yeah.
because, oh, he gave
Absolutely.
me this and it didn't work, and now I'm hopeless.
Yes.
No, try something else. No, ask more questions. No,
Exactly.
communicate. I think one of the biggest things that I share with people who are non-medical providers is keeping a diary. And I think your mom, who I worked with previously and have
Mm-hmm.
taught with her, also alluded to that too. But teaching patients how to become the drivers of their own experience as well.
Yes.
If you're having pain, it's hard to articulate to a provider what is going on in that pain experience in the moment, because you can't think clearly.
Yes.
But if
So,
you sit down and you keep a diary of, okay, here's the day I had the pain, here's what the pain felt like to me, here's what I was doing, here's what I took, here's what worked and what didn't work. That can be diet, that can be pain, that can be anything.
yeah.
But then you take that with you and say, my blood pressure's up. Well, I've measured it every day at two different times, and here's when I've
I,
noticed the
I, I do
difference.
the same thing with patients. And I think this is extremely important and very relevant to most people because, like I said, I tell this to patients that what they
Yeah,
should be doing. But we have like just a couple minutes left.
no, that's
So,
fine.
real quick, in closing, I want you to share three things that you believe that people should that can start implementing in their lives immediately to improve their health.
Um, be mindful of what physical challenges you have and what your options are for those, both short and long term,
Mm-hmm.
as far as treatment options and where you expect to be 5, 10 years down the road as a result of those treatment options.
Mm-hmm.
Um, the second, I'm sorry, repeat the question again.
Yeah, just three things that you
Oh,
think people can start implementing in their lives immediately
look at
to
what
improve
they're
their
eating.
health. Yep, their
Look at what they're
nutrition.
eating. Look at nutrition. Look at where it comes from. How are you growing it or buying it? What things are in there that you don't know about or don't want to know about, and how
Mm-hmm.
that's impacting you. And then how your experience is. It's not the same for every single person what their health journey is, but embrace your particular experience
Mm-hmm.
and come up with strategies to optimize your situation.
Beautiful.
Don't look
Don't
at everybody else.
yeah, don't have expectations for what your journey should look like, and just experience it and
Right.
do the best that you can.
Right.
Beautiful. Thank you very much. We have just
Thank
over a
you.
minute till we get cut off. I really appreciate you coming on here. Everybody that you're watching this, I know there is a lot of things that we didn't even get to touch on. So please feel free and reach out. Debbie is a beautiful source or resource. I welcome your comments, feedback, suggestions. Thank you very much for watching. Check out all the episodes on YouTube. The Art of Mindful Medicine is the name of the show. You can check out my website, www.mindful.doctor. And the shows are on Instagram Live Saturdays at noon Eastern. And as always, I end with a quote. This is from the poet Rumi. If you want the moon, do not hide from the night. If you want a rose, do not run from the thorns. If you want love, do not hide from yourself. So embrace your journey, go within, don't just accept things for what they are. Take the reins and live your life to the best that you possibly can and keep improving every day. So thank you again very much, Debbie. Thank you, everybody, for
Thank
watching.
you.
And always remember, stay awesome, stay mindful. Have a great day, everybody. Thank you, Debbie.
Bye.
Bye-bye.